Summa Health has prioritized gender equity and diversity specifically to make sure that we have a workforce that feels safe, that feels welcome, that they feel that they have an opportunity to advance, that they can really contribute to the organization as a whole. We are a critical organization for this community, and we need to make sure that this community's health care continues to be served and improved. And if you don't have an inspired, purposeful workforce, then you won't achieve your mission.
The empowerment of women in diversity is so important at Summa Health because women make up about 78% of our workforce.
In healthcare in particular, minorities represent about 30% of the workforce on the front line. But when you get into leadership, the representation of diversity dramatically falls across the country to less than 10%.
Summa Health has always been an organization that has been predominantly populated by female employees. We had not always had that same representation on the board level as well as the management level. The care has been given by women, but what we're seeing is that it's now being run by women.
I think for Summa, they really understand the importance of being the largest employer in our region and being sure to represent the demographics of this region as well.
What gets measured gets done. We at Summa Health make it a priority to have a diversity dashboard that tells us where we are doing well and what areas we have opportunities for improvement. I am very proud of the fact that we have a very engaged board that holds us accountable to make sure that we are meeting our goals in our diversity and inclusion efforts.
The board on a quarterly basis gets to look at the goals and objectives and the scorecard of what Summa is doing and the traction and actions that they have. And then Summa has the opportunity of holding the board accountable by participating with 100% participation in the DEI education.
A focus on diversity, equity, and inclusion must be woven through the daily fabric of the organization.
Summa Health is very intentional when it comes to promoting gender diversity. We have an employee resource group that's aimed to empower our women. We have Women's Summit, we have a women book club. We have lots of things that empower women and sustain women here at Summa. Having CEO support is a major factor for success. It helps when you need data, it helps when you need support for different initiatives. It helps when you have an advocate that is explaining why a whole organization needs to be intentional about diversity, equity, and inclusion. So Dr. Devney has been a major part in our success.
Not only is gender diversity, equity, and inclusion important internally in our organization, but more importantly, our focus is on the patients and their health outcomes.
When organizations make gender diversity a priority, you see a difference in their engagement scores. We've seen an increase in people feeling that there's a sense of belonging and inclusion within the workforce. And so when you make inclusion a priority, it spreads to the culture.
I think with Dr. Devney's leadership, one of the things that he's been clear is that DEI is a priority of his, and it shows throughout the Summa Health system.
As the largest employer in this community, people look to us and say, well, how is Summa doing this? And because we have the resources or our size, we really have to be an example, and we take that very seriously.
As a champion of gender equity and diversity, I am proud of the work that we've done, and I am excited to continue work in this space.
Dr. Devney, you and the entire staff, congratulations.
So on behalf of Summa Health, we are all very excited and very honored to get the Dorothy O. Jackson Award. It is extremely important to all of our workforce, our leadership, and our board. So thank you from my heart and from all of our hearts.